Being able to move about and physically interact with the world about us is something we take for granted. However, if you ever had surgery or broken a bone, you quickly realized how limited movement impacts quality of life. During the course of a day, each person adopts many positions and movements. Even while you are sleeping, you frequently change your body position. Purposeful movement results from a complex interaction of the central nervous system, muscles, tendons, bones, and joints. Because of damage to the central nervous system, some people are unable to sufficiently control their body parts to produce planned, coordinated movement. Mobility critically impacts our physical, emotional, and cognitive development. As children, we learn through physical interactions with objects in our environment. Without these experiences, a child may not keep up with their peers developmentally. The sense of control is a basic human need. Opportunities to exercise control build self-confidence and self-worth. Imagine the psychological impact of never being able to throw a ball, eat without help, swat a fly, complete personal hygiene routines independently, or leave an unpleasant situation. There are also health issues related to mobility. Movement stimulates our senses, bones, muscles, joints, and tendons. Lack of movement can result in discomfort, contractures, and unstable joints. Limited movement affects the function of many body organs, including the digestive and circulatory systems. Body positions not only affect body functions, they also influence other people's perception of us. If a person's body position appears distorted, others may see him or her as incapable or different. Correct positioning can positively influence other people's attitudes toward those who have physical disabilities. The purpose of this video is to present the basic techniques and guidelines used when positioning, turning, and transferring people with disabilities. The video will review proper body mechanics and demonstrate how to encourage cooperation and maintain the respect and dignity of the person involved. One of the most important things to remember when watching this video is that all people are different. General techniques will be reviewed and demonstrated. However, the specific techniques used to assist an individual may need to be modified by a physical therapist for each person needing assistance. The basic principles you learn in this video will help you identify when a physical therapist should be contacted for recommendations. Follow your agency policies in making such referrals. No matter how much support is given when moving or lifting a person, their privacy, dignity, and sense of control over their own lives must be protected. Think of yourself as assisting the person to move, rather than moving the person. Allow the person to be a full partner in completing the desired task.
John, would you like me to shut the door?
Before beginning to move someone, greet the person and establish privacy if possible. Take the time to talk through the entire procedure. Ask the person to help as much as they are able. Explain what you are about to do before you do it, and as you're doing it. Some people need to be prepared for movement or position changes to avoid stiffening. Slow, rhythmical movements and gentle rocking may be relaxing for the person. Whenever possible, offer choices and involve the person in making decisions about positioning, turning, and transferring.
Do you want to go back in your recliner, Myron? Do you want to stay here?
Even when severe damage to the brain and central nervous system has taken place, people can still learn movements. Learning requires the active participation of the learner. Caregivers who try to make movements meaningful increase the person's desire to participate.
Okay, now it's your turn, Mary.
Explain what you expect the person to do and give plenty of positive feedback for their efforts and cooperation.
Arms up.
Arms up.
Both of them. Way high. Thank you.
Assist when they cannot accomplish the motion alone. If the person is medically and/or physically fragile, give firm but gentle support if needed. It's important to keep in mind that these reflexes are a reaction to external stimuli, and the person's body is only trying to protect itself on a primary level. Abnormal muscle tone, asymmetrical posture, limited range of motion, and retained reflexes are interrelated. Damage to the central nervous system can result in abnormal muscle tone and retained reflexes. And abnormal muscle tone can contribute to asymmetrical posture, which can lead to decreased range of motion. Movement is necessary for normal growth, development, and even survival. Symmetrical posture, balanced muscle tone, and normal range of motion are all necessary for efficient movement. Movement is the result of a complex interaction of the central nervous system, Muscles, tendons, and bones. The amount of tension in healthy muscles is referred to as muscle tone. It is what helps us to keep our bodies in position, even when they are seemingly relaxed. This woman has normal muscle tone. She can assume a number of different positions. She can easily stretch, bend, and turn, and she can maintain the correct position during activities. If you could feel her muscles in what we think of as a relaxed state, you would see there is a certain amount of tension or tone, even though the muscles are soft and pliable. As she lifts her arm, muscle tone increases slightly. Muscle tone increases even more as she makes a fist and flexes her arm. Her muscles' ability to contract and relax, and her ability to voluntarily control her moves, are two important reasons why she can move about so easily. You can feel your own muscle tone increase and decrease by doing the same thing with your arms resting at your side. Feel the muscle in your forearm with your other hand. Then slowly raise your arm to eye level position. Now make a tight fist and bend your arm at the elbow. Your muscle tone increases. Relax your fist and bring your arm back to the side as the muscle tone decreases. When muscles are hypertonic, they contract too much and often need help to relax. A person who has hypertonicity generally has a difficult time controlling movement and changing positions because the muscles are not properly coordinated in contracting and relaxing. Myron's muscles feel extremely tense, much the way your muscles feel when you made a fist. However, his muscle tone does not relax. This continuously increased tone makes it difficult for him to bend and/or straighten. Hypotonicity is the opposite of hypertonicity. Mike's arm muscles are mildly hypotonic. Hypotonic muscles do not contract as they should. They have too little tension and feel even more relaxed than yours did when you tried to relax them. People with hypotonic muscles have difficulty controlling movement due to the lack of strength and support to move bones. Fluctuating tone means that muscle tone alternates between too much and too little. A person with fluctuating tone will exhibit uncontrolled movement. Posture refers to the total alignment of the body parts. In symmetrical postures, the body parts appear balanced on either side of the body. If we could draw an imaginary line lengthwise, the body parts on either side of the line would appear balanced. The body parts appear unbalanced on either side of the midline in asymmetrical postures. Head centered, trunk straight, arms and legs balanced. These are the criteria for judging symmetrical posture. Mike is sitting with symmetrical posture. His head is centered and upright, his trunk is straight, and his arms and legs are balanced on either side of his body. Mary is sitting with asymmetrical posture. John's posture is asymmetrical because his arms and legs are not balanced on either side of midline. Spasticity prevents Kent from assuming symmetrical posture of his trunk and extremities. Range of motion refers to movement of body parts at the joints. Range of motion is measured by the degree of movement of each joint. Each joint, therefore, has its own normal or full range of motion. The elbow's standard range of motion is 150 degrees. This woman has normal range of motion. She can easily move her joints, allowing her to do a variety of activities. Limited range of motion describes the movement of a joint that cannot move through normal range of motion. Limited range of motion is often a result of abnormal muscle tone or deformities. Myron has limited range of motion in his wrist. A contracture at the joint causes it to be permanently flexed. John has limited range of motion in several of his joints. He is unable to easily bend, straighten, or turn. Reflexes are involuntary responses to external stimuli, such as a sound, touch, or position of the head. Primary reflexes, or primitive reflexes, are normal in young infants. However, as children develop voluntary movements, reflexes normally diminish. Damage to the central nervous system may result in retained reflexes over which the person has no control. Retained or abnormal reflexes may interfere with moving, turning, transferring, and daily life functions. However, we can control the impact of a retained reflex by controlling factors which elicit the reflex. If someone has retained a primary reflex, it's critical to determine what elicits the reflex and how the person's environment can be controlled to prevent reflex movements. A physical therapist will suggest specific strategies such as head support or stabilization devices to prevent triggering the reflex.
Myron, do you want to lay down?
Some
We're gonna lay
reflexes
down
can be
now,
avoided
okay?
by greeting the person as you enter the room, approaching them slowly, and explaining what you are doing in a quiet, controlled tone of voice.
Are you ready, Myron? Put your arms up. 1, 2, 3.
It's important to keep in mind that these reflexes are a reaction to external stimuli, and the person's body
Okay, we're
is
gonna lay
only
down
trying to
now.
protect itself on a primary level. Abnormal muscle tone, asymmetrical postures, limited range of motion, and retained reflexes are interrelated. Damage to the central nervous system can result in abnormal muscle tone and retained reflexes. And abnormal muscle tone can contribute to asymmetrical posture, which can lead to decreased range of motion. Safety is a major challenge when providing assistance in positioning, turning, and transferring. About 85% of the population will experience back or neck pain at least once in their lives. These injuries are often due to improper lifting. Never assume that the principles of body mechanics apply only when lifting heavy objects or people. Often, back and neck injuries occur from repeatedly moving or lifting lightweight loads incorrectly. By sliding the chair out, Robin avoids bending sideways and twisting while lifting. The risk of injury to the person being lifted is also important. Safe practices can reduce anxiety and build trust with the care provider. Further, improper body mechanics or unsafe procedures make the staff person liable for any injury to the person being lifted or moved. By applying the principle of body mechanics and using mechanical aids, injuries can be avoided. First, arrange the room so you carry the person no further than is absolutely necessary. Then, think about the principles of body mechanics. When lifting, you should maximize the use of the strongest areas of your body and minimize the use of the weaker ones. The legs are designed for power. The spine is designed for mobility. In order to protect it, you must set it and tighten the support muscles before lifting. A healthy spine has 3 natural curves supported by an intricate system of strong and flexible joints and muscles. When balanced and properly aligned, the spinal curves along with the intervertebral discs, allowing for movement and providing shock absorption. Use of good body mechanics protects the back by keeping the spine in balanced alignment, supported by strong back and abdominal muscles. Everything has a center of gravity, or a point where the weight of the object is centered, including the human body. Our center of gravity is located in the lower abdomen. During lifting, additional stability can be achieved when a person lowers their center of gravity. Bend your knees and lower your hips to the level of the surface supporting the object to be lifted. Position the feet about shoulder width apart to create a wide base of support. Place one foot in front of the other. This allows a weight shift from one foot to the other while maintaining the body's center of gravity over its base of support. During lifting, keep the body in proper alignment and hold the object close to a person's center of gravity. Now, less effort will be needed and risk of injury will be minimized. If you bend forward at the waist during lifting, the small muscles of the back must do the work of lifting the object, as well as the combined weight of your head and trunk. This results in a force much heavier than that of the object being lifted. In addition, using only the back muscles to lift applies stress to the small joints of the spine, increasing the risk of back injuries. Shift or pivot the position of your feet to turn. Twisting during a lift adds stress on your back and should be avoided. Many workers take lifting shortcuts, which may appear to be easier or save time. Often those who have not experienced back pain do not think body mechanics rules apply to them. However, frequently, back injury is not the result of a single event, but a history of back abuse through improper lifting. To minimize your risk of back injury, avoid the following improper techniques. Lifting with the back bent forward and the legs straight places significant stress on the lower back. Twisting when lifting, like this, causes maximum stress on the lower back. Move your feet and turn your body rather than twisting. Handling the load too far away increases the stress of the load up to 10 times. Never try to lift someone that weighs more than you can safely lift by yourself. Many times another person or a mechanical device is required to move an object or person safely. Never let the person hold on to your neck. Have them hold your arm or shoulder if they are able. The following rules of basic body mechanics will help caregivers lift and move children and adults safely and efficiently. Review a mental checklist of the basic principles of body mechanics prior to initiating any lift. If the object is heavy or large, get help or use a mechanical device. Before lifting or moving an object or person, test the weight of the load to make sure it can be moved safely. Plan so you do not move an object any further than is absolutely necessary. Arrange the surface to which the object or person is to be moved as close as possible to the surface from which it is to be transferred. Lock the brakes on wheelchairs. Provide firm, stable surfaces, and if possible, transfer between surfaces of equal height. Wear low-heeled, non-skid shoes. The proper footwear will help you to maintain your base of support and protect you from back injury. Use a wide, balanced stance. A solid base of support reduces the likelihood of slipping and jerking movements. Keep your feet flat on the floor and spread them about the width of your shoulders with one foot slightly back. This foot position allows a weight shift from one foot to the other while maintaining your balance. Keep the lower back in its normal, arched position while lifting. Bend at the knees or hips. With the back arched, the forces are more evenly distributed on the support structures. Bring the load as close to the body as possible. Throughout the move, keep the arms and the object or the person as close to your body as possible. Keep the chin tucked and the head and trunk up. Tucking the chin helps to keep the arch in the lower back during lifting. Tighten the stomach and buttock muscles as the lift begins. This helps to stabilize the lower back and pelvis. Lift with the legs and stand up in a smooth, even transition. Use the large, strong muscles of the legs to straighten the knees and hips during the lift. This will decrease stress to the lower back. Move the feet if a directional change is necessary. Throughout the move, your back, feet, and trunk should all move together in the same direction, going to the same place like this. When a turn is necessary, shift your feet and take small steps rather than twisting at the waist. Move your feet in the direction of the turn. Communicate if 2 or more people are involved in the movement. This helps ensure the movement will be smooth rather than sudden or jerking. It's a good idea to count together.
Are you ready, Myron? 1, 2, 3.
Pulling and pushing are safer and easier than lifting. Use your whole body when pushing, pulling, or lifting, not just your back and arms. Help others learn and use the rules of good body mechanics. Work with coworkers to remind each other to use safe lifting techniques. Before you begin moving, lifting, or carrying people, practice with a 10 to 20 pound object such as a sack of flour. Practicing these basic principles will help you develop a mental checklist of guidelines for lifting and could help decrease the risk of injury associated with lifting and carrying. While all lifting tasks are similar to some extent, lifts and transfers of people with significant disabilities require more careful consideration. Lifting or moving people is much more challenging than lifting a heavy object. The uneven weight distribution of the human body and complex medical and physical needs of people with disabilities make lifting people complex. Odd locations and small places such as bathrooms and vehicles further complicate lifting procedures. Caregivers who do frequent lifting or have experienced back injuries may consider a back support. These devices help maintain proper back position and give abdominal support. Since continuous support can result in weakening of the back muscles, it's best worn primarily for lifting. Always remember that a back support does not replace the need for good body mechanics. Your back is under a lot of stress if you frequently assist with lifts, turns, and transfers. It's very important to maintain good posture at all times and to develop strong muscles to support the demands placed on your body during these procedures. Regular exercise decreases your risk of back or neck injury. A regular exercise program can help increase your flexibility, improve your strength and stamina, and help you relieve stress. Physical therapist Nancy Weber teaches a few exercises that can easily be done at work to improve your posture, strengthen your trunk and legs, improve your flexibility in key areas, and relieve stress.
Breathe in, count of 4, and out, count of 4. As you exhale, just concentrate on your muscles getting loose and limp. Breathe in, count of 4, and out, count of 4. And just do that several times. Often 10 repetitions is a nice relaxation number. And so basically it's bringing the chin straight back, keeping the eyes level and pulling the head straight back so that you're flattening your neck as you can. And just tuck on back. Good.
Weber also says to stretch and relax your neck muscles, slowly tilt your head toward your shoulder. Hold for 5 seconds and repeat toward the other shoulder. Then slowly turn your head to look over one shoulder, hold for 5 seconds, and repeat over your other shoulder.
You're squeezing your shoulder blades together and you're stretching your chest. And relax. This strengthens those muscles between your shoulder blades and your upper back, and it stretches out the front of your chest. And basically it balances out all that arm activity you're doing in the front of you so much of the day. You're tightening up your tummy muscles and you're squeezing your buttock muscles together to flatten out your back a little bit more.
Okay.
Okay, that's the movement that actually occurs with that exercise. And what it does is it helps to strengthen your abdominal muscles and buttock muscles, and those are key muscles to support your back, especially when you're doing any lifting activity. So you tighten those stomach muscles, you tighten your buttock muscles, and you tilt your pelvis posteriorly. And hold it there for 5 seconds, and relax. And repeat. 3, 4, 5. Relax. Let's do that one more time. Now what you're going to do is you're just going to squat down and then hold the position. 4, 5, 6, 7, 8, 9, 10, and come back up. And you can work on this one and gradually increase that holding time, even up to a couple minutes. 4, 5, relax. This is really good to build up the strength in your legs. When you've got strong muscles in your legs as well as your hips and trunk, then it's much easier to use good body mechanics. Stand with one foot approximately 1 step ahead of the other, and while keeping your rear knee extended and allowing your front knee to flex, lean forward from your back ankle, leaning toward the wall to stretch your calf in the rear leg. Hold to this one for 20 to 30 seconds because it's a large muscle group. Okay, let's go ahead and try the other side. Have that rear knee extended. Straighten it out. There you go. Stretch your hamstrings by placing one foot in a chair with your knee almost straight. Now slowly lean forward, reaching down your shin until you feel a gentle stretch in the back of your thigh, and hold that stretch for 20 to 30 seconds. And then switch legs. You're going to have your feet about a foot from the wall, shoulder width apart, and turn clockwise and place your hands on the wall. If it's too hard of a stretch, you can reposition, turn back to the midline and reposition your feet. Okay, and then try it again. And that way the wall can keep you on a gentle stretch for 5 to 10 seconds. And then go ahead and repeat in the other direction, probably wanting to reshift your feet there again. Stand with your palms on your lower back or pelvis, kind of toward the sides or toward the back, and then bend slowly backward until you feel a stretch. Hold that position for 5 seconds, and then come on up. With your neck, you can look up like you are doing, or you can just keep your head in a chin tuck. To stretch the upper back and neck, lean backward, emphasizing extension of your upper back in a comfortable stretch. And hold that stretch for 5 seconds. Okay, relax. Okay, repeat. And for some people, this exercise actually works better in a chair, where you've got some support up to that point, and then you're bending back gently over that support. To stretch and relax your lower back, sit in a chair with your knees apart and bend forward, reaching for the floor until you feel a gentle stretch in your lower back. And now this stretch can be held for 10 to 15 seconds as whatever is comfortable. Okay, and come back up, and you can go ahead and repeat. Just reaching on down until you feel a gentle stretch, and holding that stretch for 10 to 15 seconds, and come back up.
All stretches should be done slowly. The intensity should not exceed a comfortable stretch. Exhaling a deep breath as you stretch will enhance the stretch. No exercise should cause lingering pain. Exercise for the neck or back should not cause pain in the arms or legs. Exercises may be done in one session or at various times throughout the day. Think through your daily activities. If you use the flexed posture much of the day while sitting or bending, stretch in ways to reverse stressful posture. For example, if you do a fair amount of bending forward, stretch by bending backward and by stretching the muscles in the backs of your thighs. To counteract tension which builds in the upper back and neck muscles, breathe deeply and slowly to relax. Stretch by bending your upper back and neck backward, and stretch your neck in various directions. If you find it difficult to use your legs rather than your back while lifting, do wall slides a couple of times a day to build leg strength. Performing chin tucks not only helps to improve neck flexibility, strength, and posture, but when used during lifting and transferring, tucking the chin helps to maintain proper position of the entire spine, decreasing the risk of injury. Performing a few exercises on your break may send you back to work feeling better than if you sat and rested. Remember, these are to be performed several times throughout the day in order to stretch and relax your muscles. Stretching is more beneficial if it's done more often in shorter amounts of time. Observe these guidelines for the use of proper body mechanics in the remainder of this training video. In summary, the key principles of body mechanics are: stand with your feet apart, knees slightly flexed, 1 foot forward, and your head and trunk upright and in midline. Get close to the object or person you plan to lift. Support your weight on the balls of your feet. Tighten your stomach and buttock muscles. Tuck your chin and keep your spine in neutral position with your lower back slightly arched. Face the direction of movement. Never twist your spine or bend at the waist when lifting or carrying someone. Shift the position of your feet for a turn by pivoting on the balls of your feet. Lift with your legs. Carry weight as close to your own center of gravity as possible. And coordinate your movements. Count 1, 2, 3, lift. As you view this portion of the video, you'll learn how to assist people so they can attain and maintain different positions. All bodies require movement and a variety of positions in order to function with efficiency. Through proper positioning, we can help others look better, feel better, and achieve more. If you've ever been forced to stay in one position for too long, you know how uncomfortable you become. On long car trips, you begin to feel tired, your muscles ache, and your movement is stiff. Just a change in position from sitting to lying or from one sitting posture to another can help. People with limited mobility sometimes endure uncomfortable, boring, or even unhealthy positions for long periods of time unless proper positioning techniques are used. Your body's position affects what you can do and how well you're able to do it. Have you ever been lying on your side and tried to write? It's possible, but can you read what you've written? Specific body positions allow us to perform different tasks. The wider the variety of positions a person can experience, the greater their learning opportunities will be. People make judgments about our abilities based on their perception of us. Your body's position affects what other people think about you. If you visit someone in a hospital lying in a bed with a hospital gown, you tend to see that person as sick and helpless. Your perception of the person improves if you walk into the room and the person is sitting up in a chair, dressed, and looking at a magazine. Individuals with physical disabilities often look different. They may wear braces, sit in wheelchairs, or move in unusual ways. If the person with a disability is slumped in a wheelchair, other people will tend to see and treat her as different. However, if the person with physical disabilities can be assisted to sit in an upright, well-aligned posture, it can positively influence other people's perception and attitudes. Your body's position also affects how well your body parts and internal systems function. If you've ever been lying in bed for several days because of an illness, you know the effects of immobility. You may feel dizzy when you try to sit up, and your digestion, breathing, and circulation systems all slow down. The same is true for individuals who have physical disabilities, but they also run the additional risks of developing permanent contractures, skin breakdowns, and pressure ulcers. The more limited a person's movement, the greater the risk. Here are the basic principles of positioning. Promote symmetric alignment in which the head is centered and upright above the body. The spine is straight, and the arms and legs are balanced on either side of the body. Provide the amount of support needed to head, shoulders, trunk, and hips. If necessary, use adaptive equipment for stabilization. Allow the individual freedom of movement and avoid providing excessive support. Provide positioning alternatives appropriate to the activity. Adaptive positioning equipment and adjustment should be considered when a person is unable to maintain symmetrical postures without help. Clinical specialists can help determine if the person is likely to benefit from adaptive equipment. They can recommend a variety of inexpensive devices appropriate for the positioning needs of each person. Some equipment, such as braces or splints, are used to support work areas and minimize deformity. It's essential to monitor the fit to prevent skin injury.
How's that? A little bit more?
As you view the demonstrations of proper positioning,
Is that right?
note how staff promote cooperation and preserve the dignity of the person they're assisting. Overall, you can accomplish the widest variety of tasks in the upright position. The sitting position, whether in bed or in a chair, is an optimum position for eating, working, and reading. You might be able to accomplish these tasks lying down, but they're certainly a lot easier while sitting or standing. When positioning an individual in a sitting position, you may need to support the individual in this position so they don't fall sideways or forward. No matter what chair is used for sitting, there are some general principles for correct positioning. The head should be in midline and upright. Weight-bearing surfaces should be provided to the feet, buttocks, and forearms. If the person lacks head control or exhibits reflex movements, the head should be stabilized. Align trunk symmetrically with spine straight. If necessary, provide stabilization to maintain alignment. If the therapist recommends, roll shoulders slightly forward by placing rolled sheets or towels behind each shoulder. Provide support to the forearm by placing a tray or working surface just high enough so the elbows can rest at a 90-degree angle. The hands should be able to come together easily. Stabilize hips and thighs so the weight is evenly distributed over both hips. Hips should be positioned in 90 degrees of flexion. Do not try to push a person into a 90-degree position. Instead, stand behind them, tilt a chair, and let gravity help them slide back in the proper position. The purpose of a seat belt is to position the pelvis in a slight anterior tilt. It should be attached to the chair at the buttock areas and angled up to cross the hips, below the upper bumps of the person's pelvic bone. The seat of the chair should support the entire thigh to within 2 fingers, or about 1.5 inches of the knee. The knees should be flexed 90 degrees and the feet flat on a supporting surface. Align the ankles and flex them to 90 degrees. If necessary, use stabilization material to maintain the position of the legs. When positioned properly, posture should be symmetrical, head centered and upright, trunk straight, arms and legs balanced. The person should have as much use of his hands and arms as possible. During activities such as mealtime, continue to monitor the alignment of the pelvis, trunk, shoulders, arms, and feet, adjusting as needed. Remember that prolonged sitting can increase the risk of skin problems, as well as contractures at the hips, knees, and ankles. The side lying position is the most functional of all lying positions because it allows some use of the hands and arms and it prevents some primary reflexes. Lying on one side is also a sleeping position. Myron's muscles tend to be hypertonic, so before the staff positions him, she helps Myron relax by gently rocking with slow, smooth movements. She speaks in a calm voice and prepares him for the move by explaining what she is going to do. Begin with the person lying on his back. Align his trunk symmetrically. Place a firm pillow 2 to 3 inches from his back. With one hand on Myron's shoulder and one on his hip, gently move him backwards until his back touches it. Center his head in midline and support it with a thin pillow. The pillow should be high enough so the head is parallel with the lying surface. The bottom shoulder should be slightly forward of the top one. Place a pillow at his chest and waistline to help stabilize his trunk. The bottom arm should be forward and resting on the lying surface. Bring the top arm forward with hand and forearm resting on the front pillow. Hands should be free and able to meet easily. Bring hips to a symmetrical position. Bring top leg forward with knee flexed until the muscles relax. The top hip and knee should be flexed up to 90 degrees. Place a pillow under the top leg. Flex the bottom leg slightly at the knee. Look at the position of his feet. Position feet as close as possible to a 90-degree angle to the lower leg. Starting at the top of his head looking down to his feet, note the symmetry. The supine position or back lying allows the individual to take pressure off their buttocks. The head, neck, and spine should be aligned. Sharon centers Myron's head in midline and supports it with a pillow. The head is tilted slightly forward toward his chest. The staff aligns his trunk symmetrically with the spine straight. If needed, the trunk could be stabilized by placing sandbags on either side. Myron's hips are aligned symmetrically and as extended as possible. The legs are separated to approximately a hand span at the knee. If recommended by a therapist, flex the person's knees slightly and place a rolled pillow beneath. Position feet as close as possible to a 90-degree angle to the lower leg. Look at his overall position and make any necessary adjustments to maintain a symmetrical position. When recommended by a therapist, roll the person's shoulders slightly forward by placing rolled towels under each shoulder to provide support or to decrease tone. Unnecessary use of rolls behind the shoulders can promote contractures. Remember, the supine position should only be used for short periods of time. It should be avoided if the person exhibits exaggerated extension postural patterns. Individuals with hemiplegia or one-sided paralysis should have pillows or supports under the scapula, hip, arm, and leg of the affected side. The term prone refers to lying face down or on the tummy. It's preferred by many for sleeping and resting. It should be avoided for persons who exhibit total flexion posture pattern when placed on their stomachs. Nancy approaches Kyle slowly so he can see her coming. She talks to him in a calm voice and prepares him for the move by explaining what she is going to do. Nancy begins by turning Kyle's head to the side and supporting it with the pillow like this. Notice that the head is parallel with the resting surface. Flex both arms at the elbows and place them at least 6 inches away from the body. Place them so they are comfortable for the person. Position the hips as symmetrically as possible. Align the trunk symmetrically with the spine straight. If the spine tends to curve to one side, reposition it and place sandbags on either side for stability. Now separate the legs to approximately a handspan at the knees and place a rolled towel or blanket below the ankles so the toes are perpendicular to the resting surface but not touching it. If the person has difficulty keeping their legs separated, place pillows, a rolled towel, or rolled sheet between them. If his legs tend to turn inward or outward, place rolled towels or sandbags on the side toward which they tend to turn. Now look, is the person positioned symmetrically? Is he comfortable? A modification of the prone position is the prone on wedge, where the person's chest is supported on an incline. Support the arms on the wedge or firm pillow. Hang them over the top of the wedge to be free for upper extremity activities. Or place in a weight-bearing position over the top of the wedge. This prone on wedge position assists in the development of head control and upper extremity control. If you notice the person is unable to maintain a well-aligned, functional position, you should attempt to reposition the person correctly in the same position. If repositioning doesn't seem to help, position the person in a totally different position. It may be necessary to contact a physical therapist for recommendations. Let's review the principles of proper positioning in each of the positions previously discussed. In the side-lying and back-lying positions, determine whether or not the head is maintained centered at midline. Trunk is maintained symmetrical with the spine straight. Person has as much use of their hands and arms as possible, and hips and legs are maintained in a symmetrical position. In the stomach-lying position, determine whether or not the head is turned to one side. Trunk is symmetrical with spine straight, hips and legs are symmetrical, and general muscle tone is relaxed. In general, a person's position should be changed or modified at least every 2 hours to prevent development of pressure ulcers. Factors which may indicate a need for more frequent position changes are hardness or firmness of supporting surface, presence of scar tissue or skin lesions in weight-bearing areas, lack of muscle mass making bones more prominent, excess body weight, fair skin, age, poor nutrition, inability or difficulty in moving, lack of sensation. Pressure ulcers occur when bones close to the surface of the skin press the skin and body tissue against the bed sheets, reducing the flow of blood and oxygen. The backs of the heels and shoulders, the tailbone, hips, knees, and buttocks are most susceptible. You and I do not form pressure sores because we change our positions when we begin to feel uncomfortable. The average person shifts their weight in a position every 5 to 10 minutes. People who are immobile or who have lowered awareness and understanding may not be able to move or feel sensation. Wrinkles in bed linens, crumbs in bed, and sliding motions, such as sliding down in bed, cause shearing force on the body tissue and contribute to the formation of pressure sores. Moisture from perspiration or urine weakens the skin and makes it more susceptible to pressure sores. Skin breakdown and pressure sores can significantly alter a person's activities during the lengthy healing process. However, pressure sores are completely preventable with proper care and an adequate schedule for repositioning. Pressure sores are not immediately evident. Initially, the underlying tissues may be damaged without evidence of the injury appearing on the surface. With continued exposure to excessive pressure, the sore progresses until the top layers of the skin blister or crack, exposing a large and deep sore. Pressure sores can become serious health-threatening conditions. This is a scar left from a pressure sore. Therefore, it's important that skin subject to pressure be thoroughly checked for early warning signs at least daily. Normally, skin blanches or turns white under pressure. A change in the person's status may necessitate more frequent checks. If the person complains of pain, or if you see any of the following, adjust the person's position and document the change you noticed. First, areas that stay red for more than 10 to 15 minutes after the pressure is removed. Second, skin that feels warm to the touch. Or swelling. The therapist may suggest padding surfaces, which are vulnerable to pressure sores. Gel pads or special mattress systems may be used. Sometimes boots, such as this, are recommended during the lengthy healing process. Before you actually begin to move a person, take a few minutes to be sure the room is properly arranged so you will have easy access to both sides of the person. Have positioning devices like a pillow within easy reach. If you decide it's safe for you to turn the person, then there are 6 basic rules to follow. No matter which turning technique is used, these 6 rules should be applied. Before turning, greet the person, tell them what you are going to do, encourage them to help, and reinforce their cooperation as you turn them. If the person lacks head control, be sure the head is supported throughout the turn. Roll the person as you would a log. Keep the arms close to the body and keep the legs close together. Place your hands on the shoulders and hips when performing the turn. Be sure the nose and mouth are unobstructed throughout the turn. And finally, maintain physical contact with the person throughout the turn. Sliding the person will promote skin breakdown as the skin is rubbed on the bed sheets. Using a draw sheet will help to protect the person's skin and decrease the strain on people assisting with the turn. It's recommended that 2 people assist with turning most adults and larger children. In every turn, you first have to move the person toward you and the edge of the bed. Only move as much weight as you can safely handle. A draw sheet is placed across the bed so that when the person lies on it, their shoulders and hips are on the draw sheet. It may be adjusted to support the head as well. The sheet should extend over each side of the bed. These ends should be tucked under the mattress when not in use. After explaining what you're going to do, roll the draw sheet into a tight roll a few inches from the edge of the person's body. Note how the staff roll the sheet under for more stability when lifting. Grasp the draw sheet at the shoulders and the hips. On the count of 3, both caregivers rock back to pull the draw sheet in the desired direction. Rocking allows the muscles in the legs to do the work rather than the shoulders. When the person is centered in the bed, you may turn the person with your hands or use the sheet to turn. Tuck in the draw sheet and smooth out wrinkles to prevent irritation to the skin. You will find turning people from one lying position to another can be done safely and efficiently if you use these techniques. Always remember to use your knowledge of the person's physical condition. The atmosphere of trust and confidence you develop in your daily contacts will work to your advantage in the turning techniques and in the more complex transfers and moves you will learn about in later lessons. There is no substitute for experience when it comes to sights, sounds, smells, textures, and sensations of the world around us. Through these sensations, we learn and develop into the people we become. What would your life be like if severe disabilities kept you from moving freely about in your environment? For people with severe physical disabilities, it depends a lot on others' abilities to safely lift and transfer the person from one place to another. There are many correct ways to assist with transfers. Because each person has personal needs, it's best to get recommendations from your clinical specialist. Because of the person's unequal weight distribution and the positions and locations where transferring is required, it's very easy for caregivers to hurt their backs when transferring someone. Before beginning any transfer, evaluate the situation. Determine the person's abilities and the type and amount of assistance needed. Get help if needed. Transfers are always easier to perform with 2 people, and it's much easier to ask for assistance before beginning the transfer than during the transfer. Check your foot position and the alignment of your back. Move as close to the surface you are lifting as you can, and if possible, Position so that the person can see where they are going. During the transfer, keep these things in mind. Use your legs to lift. Shift your weight and pivot on the balls of your feet. Keep the movement as smooth as possible. Sudden movements can trigger a reflex. If the person has more significant impairment on one side of the body, plan the transfer so they will be moving toward their most stable side. Keeping in mind what you learned about proper body mechanics, watch as Nancy and Kyle demonstrate the one-person bed-to-chair transfer. Position the person so he's facing you in a side-lying position at the edge of the bed. Now stand close with your feet spread about shoulder-width apart. Slide one arm under the person's head and cradle the upper body. Allow his head to rest in the fold of your arm and place the palm of your hand flat against the person's back. Place your other arm over and around the person's knees and grasp the back of the person's bottom knee. This is a critical movement. The risk of injury and accidents is greatest when lifting, so make sure you're prepared. Are your feet spread shoulder-width apart? Are your knees bent? Is your lower back in its normal arched position? With one continuous movement, simultaneously pull the person's legs toward you and down, and raise his shoulders, bringing him to a sitting position at the edge of the bed. With one hand, pull the chair close to you and lock the brakes. Straddle the person's knees so that your upper bodies are close together. If necessary, allow the person's head to rest on your shoulder. Keeping the person's upper body close to yours, slide your arms under theirs and grasp the center of the transfer belt. It will make your lift easier if the person can keep his arms on top of your upper arms, but not around your neck. Bend your knees and hips so your shoulders are no higher than the person's shoulders. Gently pull your arms toward you to maintain firm contact between the person's upper body and your own. Feet should be shoulder-width apart with one foot back. Bend your knee to maintain contact with the person's leg. Place your weight on the other foot. Before lifting, ask yourself, is the chair positioned and the brakes locked? Is your body set for the move? Are your legs and feet positioned correctly? Is your lower back in its normal arched position? And is the person ready for the move? With one continuous motion, simultaneously pull the person's body off the bed and shift your weight to your back foot. Pivot on that foot toward the chair and gently lower the person into the chair. Nancy encourages Kyle to assume as much of the lifting and weight bearing as he can. Position the person properly in the sitting position. Before transferring the person from chair to bed, interlock your fingers just below the person's back and slide him towards the edge of the chair. Gently pull the person toward you until your upper bodies touch. Position your feet correctly with one foot back. With one continuous motion, lift the person, shift your weight to the back foot, pivot, and transfer the person to the edge of the bed. To return the person to a lying position, place one hand behind the person's upper back and grasp him under the opposite arm. Reach under the person's knees with your other arm using good body mechanics. Simultaneously lift the person's legs onto the bed and lower his upper body into a lying position. Many transfers require two people working together as a team, for example, when raising or lowering someone from one level to another, such as after a fall. Watch as Nancy and Mary demonstrate the two-person transfer from floor to chair. The chair is placed as close as possible, facing the direction Robin's feet are pointed. Lock the wheels on wheelchairs and lower or remove the armrest nearest the person and raise the footrests. Robin is positioned on her side, facing away from Nancy about 10 inches from the chair. Nancy kneels with both knees touching Robin's back and grasps the bottom shoulder. Meanwhile, Mary kneels in front of Robin's knees and places one hand on Robin's top hip. She wraps her other arm over and around Robin's knees and grasps the bottom leg just above the knees, flexing the knees toward her chest. Nancy, the leader, gives the starting signal, and on the count of 3, the team moves simultaneously. Mary keeps the person's knees flexed and pushes down on the top hip. At the same time, she pulls the knees up and turns them away until they are upright and flexed. At the same time, Nancy pulls and lifts Robin's upper body until she is sitting up. Continuing to provide support to the upper body, Nancy kneels behind and close to Robin's back. Nancy slides her arms under Robin's arms and grasps them just below the elbows. She gently pulls them in until they press against the lower rib cage. Meanwhile, Mary squats in front of Robin's knees. She keeps her weight on the far side foot and locks her hands behind Robin's knees. Now positioned correctly in preparation for standing and lifting the person, they set their backs in good alignment and hold the person close. At Nancy's signal, they stand and lift the person using the strong muscles in their legs. Robin is lifted straight up until they are standing upright, and Robin's buttocks are higher than the chair. Now, on signal, sliding side steps are taken to position Robin directly above the chair seat. They lower Robin into the chair by bending their hips and knees while keeping their backs in good alignment. Sometimes two people are needed to transfer a person from a bed to a chair. The technique we have demonstrated can be modified for this transfer. The staff slide Myron toward the edge of the bed and work together to bring him to a sitting position. The lifters may work with one knee on the bed and the other foot on the floor. Next, they assume the proper hold of Myron's upper body and knees and prepare their bodies for the lift. On the count of 3, and using good body mechanics, simultaneously lift and complete the transfer, lowering the person to the chair. In all two-person transfers, it's important each partner know the techniques and work together, and the movement be well-timed and smooth. The Hoyer lift can make transferring persons, especially adults, easier and safer. Some agencies require that lifts with the Hoyer lift always be performed by 2 people, one to support the person being moved and the other to move the Hoyer to the desired location. While the Hoyer lift can be used safely by one person, an assistant should always be present until the person operating the lift is sure they can safely transfer alone. The following demonstration involves the transfer of a person from the bed to their chair. Explain the procedure and provide privacy. Always use a sling which is the correct size and in good repair. Roll the person to one side and position the sling under the person's back and thighs. Roll the person to the other side and pull the sling through. Move the lift base into position with the legs under the bed. Legs of the Hoyer are to be in the wide spread position. Position arm bracket directly over the person. Attach the chains. If the Hoyer has hooks, attach the sling with the hooks facing away from the person. The short chain is for the sling back, and the long chair is for the leg portion of the sling. Standing next to the bed, Sharon raises the Hoyer until John's buttocks are approximately 1 inch above the bed. Once John's buttocks have cleared the bed, Sharon backs the Hoyer lift away, freeing the legs of the Hoyer from under the bed. She rolls the Hoyer, with John suspended in the sling, over to the wheelchair, approaching the wheelchair from the front. John is positioned over the wheelchair seat facing forward. Sharon gently and slowly lowers John into the chair until there is slack in the Hoyer chains. They protect John's head from possible injury. The chains are detached and John is positioned in the chair. The PAL is another example of a mechanical lift. Watch as staff use the PAL to transfer Mary from her wheelchair to her bed. The Easy Stand can also make transferring persons easier and safer. Position the top of the harness around the upper body of the person, about 2 to 3 inches below the underarm. For the person's safety, securely fasten the safety strap around the person's chest and pull the loose strap to tighten. Use the spreader bar to open the legs to get around a wheelchair. Position the unit in front of the person. Have her place her feet on the platform and position her shins into the shin forms. With the lift arm in the lowest position, attach the harness hooks at the end of the Easy Stand arm using the loops provided. Use the shortest loops when possible, being sure to use the same loop on each side. Position her arms on the outside of the harness and place her hands on the paddle handles. Take the hand control and stand beside her. Press the up button. Stop lifting when the person is in the standing position. Now, in the standing position, transfer to the desired location with the lift legs in the closed position. When lowering the person onto the chair, toilet, or bed, stand beside her. Press the down button on the hand control until she is fully lowered. When she is securely seated, lower the lift arm until there is enough slack to unhook the harness loops from the lift arm. Move the unit away from the person until there is room to remove the harness. Unfasten the straps or buckle that is across the person's chest and remove the harness that is behind them. Additional lifts are available for the tubs and swimming pools. Fan lifts or stair glides may also assist with transfers. Sitting transfers may also be performed with a sliding transfer board. The wheelchair should be positioned beside the other transfer surface at a 45-degree angle. The brakes must be locked, the armrest on the side closest to the other surface must be removed, and the footrests out of the way. The transfer sliding board is placed so it is resting securely on both surfaces, first under the person's buttocks. The person may need assistance starting the slide and support throughout the transfer. If the person is unable to assist in any way, the caregiver supports the person's knees with their knees to keep them from sliding forward. By leaning his trunk forward, the caregiver can support him with her arm. She either grasps the transfer belt or the person's waist. Once the desired position is achieved, the board is removed. These transfer techniques can be used in a number of lateral transfer situations. Bathroom and automobile transfers, more than any others, must be tailored to meet the needs of specific places and people. Bathroom sizes and arrangements vary widely, and so do automobiles. However, do not allow these unique conditions to set roadblocks for people getting out and about. Ask your clinical specialist to recommend the best automobile and bathroom transfers for the people with whom you work. Here are some general lateral transfer guidelines. Move wheelchairs as close as possible. Maintain a solid base of support. Avoid swinging the person. Pivot carefully and keep your feet under you at all times. When using a transfer belt, place it snugly around the person's lower waist. This is to avoid injury to the ribs and soft tissue just under the ribs. Check to be certain it's securely fastened to prevent it from sliding up the person while lifting. Position the wheelchair as close to the seat as possible. Shift the person to the front edge of the chair. Get into the proper position and prepare your body to make the transfer. Lift, pivot, and transfer the person to the edge of the couch or chair. Now position her against the backrest. Use any positioning or stabilization aids necessary to make the person comfortable. When transferring a person to a shower chair in a tub, begin with the person in a seated position in a chair parallel to the tub. From this point, a regular sitting or standing transfer is performed. Lift the person's legs into the tub and assist them to slide over to the center of the tub. To avoid burns, always turn the cold water on first and off last, and try not to turn the water directly onto the transferred person until the water reaches the desired temperature. Try to respect the person's privacy during this procedure. It's typically simpler to remove the person's clothing before the transfer, but provide a towel for cover-up to preserve dignity. The procedure for transferring from the chair to the toilet will vary depending on the space available in the bathroom and the person's ability to assist with the transfer. Always position the chair as close to the toilet as possible. The person's clothing is raised and lowered while in the chair rather than on the toilet. It works best if both the chair and toilet seat are the same height. The sitting transfer is then applied to move the person from the chair to the toilet and then back to the chair again. For most adults who cannot bear weight or assist with the transfer, a mechanical lift is the safest way to transfer from chair to toilet or for showering. When transferring to and from a car, it's easier to use the passenger side of the front seat as it has more room than the back seat. The car seat should be moved back and the wheelchair positioned as closely as possible to the car seat in as parallel position as possible. Try to avoid transferring from a curb, as the height difference between the car seat and the chair will be significant. Remember, lift with your legs, not your back. Help the person lift their feet into the car and position correctly. A mechanical lift is the safest way to transfer most adults who cannot bear weight or assist in the transfer. Remember that in every transfer there are three basic considerations. First, know the person. How will a particular person's characteristics affect the method of transfer? Consider factors like weight and size, muscle tone, retained or abnormal reflexes, and the ability to bear weight. Second, know yourself. What are your capabilities for lifting and carrying? Third, know your technique. Whether using one we demonstrated or one recommended by someone else, use good body mechanics while carrying it out. Your skill carrying out transfers can mean a great deal to people with disabilities whom you are assisting. With our help, they can get there from here.